Bismillahirrahmanirrahim. The quote of the day is your child's mental health is more important than their grades. Let them be little, let them be creative, let them play often. In short, let them be children. Today, we will discuss about the neonatal care under the kind supervision of Professor Dr. Saira Afzal. The learning outlines of today's presentation is Introduction to Neonatal Care, Components of Neonatal Care, Steps involved in Neonatal Care on national level, recent updates, and at the end are the MCQs. At the end of this presentation, participants will be able to describe about the introduction of neonatal care, aims of neonatal care, its components, and progress at national level. Now, what is neonate? A newborn baby, specifically a baby in the first 4 weeks, that is the 28 days after birth. After that time, a baby is no longer considered a neonate. Now, what is neonatal care? Neonatal care is a type of care that should be given to a baby born either full-term, premature, or sick in home or either in hospital environment. Neonatal units are a part of hospitals which provide care for babies who are born prematurely, that is before the 37 weeks of gestation, with a medical condition which needs treatment or at a low birth weight. Now, what is the importance of neonatal care? Since more than one-third of all child deaths occur within the first month of life, provided skilled care to mothers during pregnancy as well as during and after birth greatly contributes to child survival. All newborns require essential newborn care to minimize the risk of illness and maximize their growth and development. Warmth, normal breathing, mother's milk, and prevention of infection are the basic needs of normal baby at birth. Now, what are the objectives of neonatal care? The main objectives are observe and record the infant's vital signs, monitor weight loss or gain, monitor bowel and bladder function, monitor activity and sleep patterns, monitor infections and bonding with parents. To provide safeguards against infection, to initiate feeding, to provide guidance and health instructions to parents. Now, the neonatal care at home. The highest proportion of deaths of mothers and newborns occur during delivery or within 24 hours of birth. In developing countries, only about 13% of mothers and infants receive postnatal care within 24 hours of a home birth. In response to this situation, WHO and UNICEF recommend a postnatal visit to a health facility as soon as possible after home birth. Where this is not possible, they promote home visits to mother and infant within 24 hours on the third day and if possible before the end of first week after the birth. Immediate care of a newborn. It involves, as soon as the baby is born, dry him gently all over with a clean, dry cloth and discard the wet cloth. Wipe fluids from the nose and mouth with a clean cloth. Do not rub away the white film on the baby's skin. It protects the skin. Cover the baby with a second dry, clean cloth to keep it warm and then cover the baby's head. Check to see if the baby is breathing well. Once cord is cut, place baby on the top of the mother's tummy or chest, which forms a skin-to-skin contact. Cover with a dry clean cloth to keep both of them warm, and then cover the baby's head. If the baby is not crying at birth, rub her back deeply to make her cry and take a breath. Do not handle the baby upside down, slap the feet, and pinch the chest. The first hour after birth, when a mother has uninterrupted skin-to-skin contact with her newborn, is referred to as the golden hour. This period of time is an integral factor in a mother's breastfeeding journey if she chooses to do so. Skin-to-skin contact is even recommended outside of the delivery room walls. Kangaroo care is a method of holding a baby that involves skin-to-skin contact. The baby, who is typically naked except for a diaper, is placed in an upright position against a parent's bare chest. Both mothers and fathers can do a kangaroo care. Now, how to assess the baby's breathing and color. Assess as you dry the baby, check to see if the baby is breathing. The normal rate is from 30 to 16 breaths per minute. The baby's skin color is pink. If the baby is having trouble breathing, gasping, or not breathing, quickly clamp and cut the cord, leaving a stump at least 10 centimeters long. Call for help and start resuscitation immediately. Now, the upgrade score. It is very important while assessing the newborn. A blue color of the tongue, lips, and tongue is sign of a lack of oxygen in the blood. A bluish color of only the hands and feet may be present after birth and usually does not indicate a lack of oxygen. Continuously assess the upgrade score at 1 minute, 5 minutes, and then at 10 minutes. Now, this is the upgrade score. It involves 5 criteria by which the upgrade score can be assessed. This involves activity, pulse, grimace, appearance, and respiration. Each criteria is assessed from 0 to 2 points. 0 is the worst and 2 is the maximum score. And if we add all these 5 criteria, we will have the upgrade score. And if it comes out to be 0 to 3, then the baby is said to be severely depressed. And if the upgrade score is from 4 to 6, then it baby is moderately depressed. And if the upgrade score is range from 7 to 10, then we will say that the baby is in his or her excellent condition. Now, what is a meconium stain baby? In neonates born through meconium stain amniotic fluid who do not start breathing on their own, suctioning of the mouth and nose should be done before initiating positive pressure ventilation. Deep and aggressive pharyngeal stimulation with the suction catheter may cause arrhythmia and should be avoided. Know how to clamp and cut the cord. Cut the cord within 1 to 3 minutes after birth for all births while initiating simultaneous essential newborn care. Early cord clamping is less than 1 minute is not recommended unless the neonate is asphyxiated and needs to be removed immediately after resuscitation. Do not apply anything on the cord stump and leave it uncovered. Clean dry cord is recommended for newborns born in health facilities and at home. Know why the cord is cut within 1 to 3 minutes and not immediately after birth, because it will also give opportunity to draw extra 2 to 5 milliliters of blood which will be delivered to the baby from the umbilical cord. So it is cut after 1 to 3 minutes. Now keep the baby warm. Newborns without complications should be kept in skin to skin contact with their mothers during their first hour to prevent hypothermia and promote breastfeeding. Cover the mother and baby with a clean blanket. It is recommended that the best temperature for the babies is between 20 to 22 degrees Celsius. Help the mother initiate breastfeeding. Have the mother initiate breastfeeding within the first hour of birth. Most newborn babies are ready to feed as early as 15 minutes after birth. Help the mother with correct positioning, attachment, and suckling. Give the baby the first yellow breast milk to protect him from illness. Mother should breastfeed the baby whenever she wants to feed. Only feed the baby from the breast. No other feeds such as water, sugar water, or butter, gouty are necessary and may harm the baby. Baby does not suck or sucks poorly. Which actions to take? Mother should offer breast often. Help the mother to sit and lie comfortably. Hold the baby's body against hers. Have the baby face the breast. Hold the breast and touch the baby's cheek with the nipple so the baby turns and opens mouth. Fix the baby's mouth on the nipple. Make sure baby is in a comfortable position to feed. Eye care. Within 1 hour after birth, give the newborn eye antimicrobial medication to protect the baby from serious eye infection. Give antiretroviral vaccine prophylaxis. Antiretroviral prophylaxis to all HIV exposed neonates according to the neonatal guidelines on prevention of mother to child transmission. Know how to prevent bleeding in newborns. Give 1 milligram of vitamin K intramuscularly to all neonates, including preterm after birth, and give 0.5 mg vitamin K IM to all to those neonates whose weight is less than 1 kg. Check if cord stump is bleeding. If it is, put on an additional clamp between the abdomen and the existing clamp. Non-neonates identity. Place the infant's identification band on the wrist or the ankle with mother's name and sex of baby on it. Weigh the baby. It is not necessary to weigh the baby immediately after birth. All infants should be weighed after stabilization and warmth. A single-use paper towel or a sterile cloth towel should be placed on the weighing scale beneath the infant. Record all observations and treatment provided in the appropriate chart. Make sure these things happen in the first 7 days after birth. Mother and baby should see a health worker to be sure both are healthy. Give the baby vaccine to protect her from preventable disease. Learn when to come for the next chore for baby. If wanted, choose a method to space the next birth for at least 36 months. Register the birth. Give the mother vitamin A to protect her and baby. Now, what are the alarming signs in the baby which the mother should be aware of? If the baby shows any of these signs, see a healthcare worker or trained community volunteer right away. If the baby has trouble feeding, less energy, too hot or cold, trouble breathing, fits, infected belly button, eyes or skin, baby's belly button, eyes or skin is very infected, eyelids are puffy or red, pus oozes from the eyes or belly button smells bad, skin has a rash with pus, skin or eyes become yellowish. Now the neonatal resuscitation. High risk deliveries that may require resuscitation include those deliveries which are less than or equal to 36 weeks of gestation, those which are meconium stained, fetal distress, non-congenital malformations, multiple births, malpresentation, maternal complications like in diabetes, hypertension, and hemorrhage. Now, this is the algorithm for the resuscitation of a newborn. After birth, assess if the baby is in term gestation, if the baby is breathing, and if the baby is in good tone. If these are all good, then routine care with mother will be given to the baby. And if these parameters are not present, we have to provide warmth, clear airway if necessary, dry and stimulate. Don't try if the baby is less than 30 weeks of gestation. Wrap preterm baby's torso in plastic bag and note the time. And then if the baby has apnea, gasping, or heart rate is below 100 beats per minute, and if the baby has not these parameters, then labored breathing or persistent cyanosis. Look for the labored breathing or persistent cyanosis. Position and clear airway. Monitor the saturation of oxygen. Supplement oxygen as needed, and also consider CPAP. And if these things are present, then positive pressure ventilation at a room air and saturation of oxygen monitoring and ECG monitoring. And if the heart rate is below 100 beats per minute, check if the chest is moving. Ventilation corrective steps will be needed, and endotracheal tube will be needed. And if the heart rate is below 60 beats per minute, intubate if not already done. Chest compressions and positive pressure ventilation. Three compressions, the chest compression will be given at the rate of three compressions to one breath. Each cycle should take about 2 seconds and give 100% oxygen and monitor ECG. And if the heart rate is still below the 60 beats per minute, 0.1 ml per kg of IV adrenaline, that is of 1 ratio 10,000 dilution, will be given. If heart rate is persistently less than 60 beats per minute, consider hypovolemia, consider pneumothorax. Now, the delivery room. For the very low birth weight infant in stabilization room, remember the thermal control is the major issue. Raise the temperature of the stabilization room to a maximum and raise the temperature of the scrub room to 25 degrees centigrade. As soon as possible after drying the infant, cover with recommended food grade polythene, plastic, uh, plastic or pre-warm blanket. Now the post-resuscitation care. An infant who has required resuscitation must have close monitoring and management of oxygenation, infection, blood pressure, fluids, apnea, blood sugar, feeding, and temperature. Be careful not to overheat the infant during or following resuscitation. No withdrawal of resuscitation. Discontinuation of resuscitation efforts may be appropriate if there are no signs of life in an infant after 15 to 20 months of complete and adequate resuscitation efforts. Neonatal care in hospital. Neonatal care is the type of care a baby born premature or sick receives in a neonatal unit. Units are a part of hospitals which provide care for babies who are born prematurely with a medical condition which needs treatment or at low birth weight. The word neonatal means newborn or the first 28 days of life. Babies are admitted into neonatal care for many different reasons. The main reasons for a baby to be admitted are they are born prematurely, they have a low birth weight, they have a specific medical condition which needs treatment in a hospital. For the medical conditions treated in the neonatal units treat a number of medical conditions. Your baby may have a condition because they were born early, or if they were born at term, the staff will give you information about your baby's medical condition. But if you ever want to know more, you can ask them. They will be happy to talk to you about any questions you might have. Why are there different levels of neonatal care? There are different types of neonatal units in national health system, and they are named depending on the level of specialist care they offer. Special care baby unit, sometimes called low dependency unit, local neonatal units, neonatal intensive care units. Now, what are the special care baby units are the low dependency unit? This is for babies who do not need intensive care. Often this will For babies born after 32 weeks of gestation, their care may include monitoring their breathing or heart rate, giving them more oxygen, treating body temperature, treating low blood sugar, helping them feed sometimes by using a tube, helping babies who become unwell soon after birth. Sometimes the baby might be admitted to a special care baby unit for phototherapy to treat blindness, but sometimes this condition is transitional. Now, what are the local neonatal units? Babies who need a higher level of medical and nursing support are cared for here. Care on local neonatal unit might include breathing support given through their windpipe, short-term intensive care, care during short periods when they stop breathing, continuous positive airway pressure, or high flow therapy for breathing support, feeding through a drip in their vein, that is called the IV parenteral nutrition, cooling treatment for babies who have had difficult births or are unwell soon after birth, helping babies who become unwell soon after birth. Now the neonatal intensive care units. This is the level of care for babies with the highest need for support. Often these babies will have been born before 28 weeks of gestation or be very unwell after birth. Some patients are transferred to a different hospital which has a neonatal intensive care unit before the baby was born. This is usually because the staff feels that baby would benefit from this level of care because it is safer to transfer the baby before they are born. Babies are cared for here when they need breathing support given through their windpipe, have severe disease affecting their breathing, need or have just had surgery. At a neonatal intensive care unit, all levels of care may also be given to babies from the local area. Now the transitional care. This is where you and your baby stay together in hospital while as you and team care for your baby. It means your baby is well enough to stay with you either in the hospital ward or a room on the neonatal unit with support from the hospital staff. You will be in the hospital for 24 hours a day. Some babies born between 32 to 37 weeks of gestation or babies with mild jaundice or feeding problems get the care they need in this way. Now, what comprises the neonatal team? These are the nurses that provide most of the day to take care for your baby. They can answer your questions, show how to feed and take care of your baby, and arrange for you to speak to the doctors. Next is the doctors. Doctors coordinate your baby's treatment. They can answer your questions about your baby's treatment, medical condition, and progress. Next are the therapists. There are different type of therapists that specialize in different parts of your baby's development. Next are the physiotherapists and occupational therapists. These are the trained to help with your baby's physical and social development. Speech and language therapists are trained to assess your baby's ability to feed and swallow. Next are the dietitians. Dietitian make sure that your baby gets the best possible nutrition. They can explain what nutrition your baby needs. Next are the ophthalmologists and auditory technicians. These members of staff will check your baby's eyes and ears. Next are the radiographers. You will meet these staff members if your baby needs an X-ray or scan. If your baby needs an ultrasound, this will be carried out by consultant who specialize in X-ray and other scans. No, the condition of neonatal care in Pakistan. The neonatal mortality rate in Pakistan has improved gradually from 1975. In 1975, the neonatal mortality is 74.5 uh, deaths per thousand live births, and which improved gradually in 2020. And in 2020, the neonatal mortality rate is 40.4 uh, neonate deaths per thousand live births. Over 65% of total neonatal deaths occurring globally belong to just 10 countries. Pakistan ranks third among these 10. It is estimated that almost 300,000 newborns die annually in the country. The latest reported neonatal mortality rate is 40.4 per thousand live births, accounting for around 7% of neonatal deaths happening globally. Now, these are the different indicators of uh, neonatal morbidities and mortalities in Pakistan. In the postnatal care for newborns, the percentage of newborns who have a postnatal contact with the health provider within the 2 days of delivery, these contributes about 64%, and 20% of newborns have early initiation of breastfeeding, and 48% of babies have exclusive breastfeeding from 0 to 5 months, and 57 of newborns have continued breastfeeding up to 23 months, and 37% of the newborns have height for age less than 2 standard deviation, and 0% of the newborns have vitamin A2 disease coverage, while the 69% have iodized salt consumption greater than 0 parts per millimeter 0 parts per meter among all the tested households. New programs help women and newborns survive and thrive in Pakistan's northeastern province. It is by Khyber Pakhtunkhwa's Health Department, UNICEF, and United Kingdom's Foreign, Commonwealth and Development Office team up under the Nawab Raz program. KPK's Health Department has launched a new initiative with technical support from UNICEF and generous funding from the UK's Foreign, Commonwealth, and Development Office. The Nawab Raz program, that means a new day, promotes positive changes in behaviors and attitudes towards mother and child health care, while supporting the provision of safe and essential healthcare for pregnant and lactating women to help mothers and child survival. Between April 2019 and August 2020, November's mobile outreach teams provided 500,000 people with access to essential basic health services such as antenatal and postnatal care and immunization, including more than 20,000 pregnant women who received antenatal care through door-to-door outreach services. There is another initiative by UNICEF, whose title is New Initiative Help Keep Every Child Alive in Pakistan, that is organized by Punjab Health Department and UNICEF, help treat sick young infants suffering from possible serious bacterial infections close to home, including during COVID-19. Working in partnership with Punjab's Health Department, UNICEF has implemented the Possible Serious Bacterial Infections initiative in Punjab primary and secondary health facilities since 2018. The project is now implemented in 10 districts of Punjab, that is the Pakistan's most populous province. So far, 245 doctors, nurses, and lady health workers have been trained on the integrated management of newborn and childhood in illness, which include possible serious bacterial infections. This has already benefited 250 infants in 3 districts. UNICEF has also provided facilities with medical supplies. The initiative has also been piloted in 2 districts of neighboring Sindh province. More trainings are planned in the near future. With support from UNICEF, the possible serious bacterial infections initiative has now reached a total of 682 primary healthcare facilities across Punjab. The government is expected to scale up the initiative across the province in coming months. Now the time for recent updates. Here is an article that is published in 2022, whose title is Newborn Hearing Screening Benefits Children, but Global Disparities Persist. There is substantial evidence that newborn hearing screening reduces the negative sequelae of permanent childhood hearing loss if performed in programs that aim to screen all newborns in a region or nation. The WHO has called into resolution for the implementation of such programs and for the collection of large-scale data to assess the global status of newborn hearing screening programs which surveyed individuals potentially involved with newborn and infant hearing screening in 196 countries. NIHS, followed by early intervention and accompanied by measures preventing childhood hearing loss, has been shown to be effective, cost-efficient, and an excellent investment of resources. Our survey confirmed for the first time worldwide that newborn hearing screening benefits children in terms of early diagnosis and treatment initiation of permanent childhood hearing loss, but that large global disparities remain as the world moves toward achieving the 2015 Sustainable Development Goals and universal health coverage. It is important that the needs for the children with hearing loss are addressed and no one is left behind. For them all to achieve their highest attainable standard of health, the provision of newborn hearing screening as part of national plans for universal health coverage is a matter of equity and equality. Now the time for MCQs. First MCQ is, a baby born on 12 January 2021 had complaint of severe dyspnea and cough on 18 February. That is about 5 weeks after her birth. The same year, the baby is taken to a hospital by her parents. She needs hospital admission according to trained staff there. She should be stayed at whether in nursery, neonatal care unit, intensive care unit, child intensive care unit, or COVID unit. Yes, neonatal care unit B is the correct option. The baby will be stayed in. D, Delta is the correct option. Child intensive care unit. Delta. As the baby has been passed from his neonatal age, no, he is in infancy, so he will be shifted to the child intensive care unit. Delta is the correct option. Question number 2. Which of the following statements is true of the Upgate score? First option is Upgate score stands for airway, pulse, gasp, alertness, and reflexes. Second option is umbilical cord gases are not as reliable as Upgate score when it comes to assessing the severity of asphyxia. An Upgate score of 7 at 1 minute means the baby requires immediate advanced resuscitation. Delta option is an Upgate score of less than 5 at 10 minutes is associated with the poor outcome. An Upgate score of 6 at 1 minute means the newborn is well.
Beta. Beta.
Delta is the correct option. Yes, Delta is the correct option. As the 7 to 10 Upgate score is indicates that the baby is well, while the other options do not relate to the Upgate score. Third MCQ is Dr. Madhu, will you please mute your mic? Third MCQ is a medical student is asked to examine a newborn. The best approach should be newborn examinations are only undertaken by a senior doctor. Second option is the newborn examination can be undertaken anytime in the first 6 to 8 weeks of life. Third option is the examination can be performed provided that the baby has been fed, is warm, and is not unwell. And Delta option is a system-based approach is better than the head-to-toe approach. Last option is examination is delayed when the newborn is in distress.
D.
Yes, Delta is the correct option. Our system, Charlie, C is the correct option. The examination can be performed provided that the baby has been fed, is warm, and is not unwell. C is the correct option. Question 4 is the recommended room temperature for maintaining warmth for the neonates is whether 20 to 25 degrees centigrade, 25 to 28 degrees centigrade, 28 to 30, 34 to 37, or above 37 degrees centigrade.
Delta D.
Beta.
Delta.
Alpha is the correct option, 20 to 25 degrees centigrade. This is the recommended room temperature for maintaining warmth of the neonates. Question 5 is an infant born to mother at 40 years of age at full term. She is taking warfarin for her medical condition. The baby born to her is about 2.6 kg to prevent bleeding in such neonates. Which dose of vitamin K will be given with which route? Option A is 0.5 mg of vitamin K intramuscularly, 1 mg of vitamin K intramuscularly, 0.5 mg vitamin K intravenously. Delta option is 1 mg vitamin K intravenously or 1 mg vitamin K orally.
Alpha.
A.
Beta.
Yes.
Alpha.
Beta. 1 milligram vitamin K intramuscularly is the correct option. If the baby weight is in normal limits, as the baby's weight is 2.6 kg, so the recommended dose is 1 milligram of vitamin K intramuscularly. But if the baby's weight is less than 1 kg, then the dose is 0.5 mg of vitamin K intramuscularly. So beta is the correct option regarding this MCQ. Sixth MCQ is a newborn is said to be asphyxiated when respiratory rate is less than 12 per minute, less than 18 per minute, 20 per minute, 24 per minute, or less than 30 per minute.
A.
E.
Yes, E is the correct option, as in newborns, and the normal respiratory rate ranges from 30 to 60 beats, 30 to 60 breaths per minute. So E is the correct option. Seventh MCQ is a male baby born to a mother at full term. Baby was in distress and passed meconium. Grade 3 meconium stain liquor is seen. Baby is having tachypnea. Immediate care of the newborn at this stage should include whether shift to transition room, shift to neonatal ICU, dry and clean the baby and hand over to mother. Suctioning of the mouth and nose should be done. And the last option is deep and aggressive pharyngeal suctioning.
E.
B.
Charlie.
Delta is the correct option. The baby is meconium stain in his nose or mouth, so suction of the mouth and nose will be done. That will be the gentle suction, not deep and aggressive pharyngeal suction. Eighth MCQ is after delivery, The cord of a newborn is clamped and it should be cut in approximately, whether in less than 1 minute, 1 to 3 minutes, 2 to 5 minutes, 5 to 7 minutes is the standard time for removing cord, or after 10 minutes.
Beta, Charlie.
A,
Beta 1 to 3 minutes is the correct option. This is recommended to cut the cord between 1 to 3 minutes because it will give a time to drain the extra 2 to 5 milliliters of blood in the umbilical cord that the baby can get from the umbilical cord. Ninth MCQ is: a baby is born at 27 weeks following spontaneous preterm labor. You arrive in delivery room just as the baby is being transferred to the resuscitation platform. Which of the following is the correct action that should be taken? Ask the obstetrician to administer antifungals to the mother. Don't worry about the universal precautions as resuscitation cannot be delayed. Put the newborn immediately after birth on mother's bare chest. Dry the baby, wrap in several warm towels, give antibiotics, and then assess the condition of the baby. Place the baby in a sterile plastic bag up to the neck or cover. In a plastic bag, cover the head with the hat and place the baby under a radiant warmer.
E.
alpha,
Eta.
E. Elephantia is the correct option. Those babies who are born less than the 26 weeks of gestation, their immediate care involves that you should not dry the baby. The immediate care that is needed is to wrap the baby in a sterile plastic bag and then cover the baby's head and then put him in the radiant warmer or a warm blanket. So elephantia is the correct option. 10th MCQ is: a newborn's 5-minute upkeep score is 5. Which of the following nursing intervention will you provide to this newborn? Whether routine post-delivery care, keep in delivery room and continue to monitor and reassess the upkeep score in 10 minutes. Some resuscitation assistance such as oxygen and rubbing the baby's back and reassess upkeep score. Full vigorous resuscitation for 15 to 20 minutes is given, or no use of any measures